Well, good morning, good afternoon and good evening to wherever you are in the world. Welcome to our 15th COVID-19 Impact webinar run by Cilt International. We're delighted to bring you quite a specialist theme today, but hopefully one that resonates right across the world. And this is looking particularly at how COVID-19 has impacted across lower income countries. We're delighted that we're going to hear from speakers that have been hard at work researching the impact of COVID-19 on transport across Tanzania and Eastern Africa, but also we're going to hear from speakers as far away as Australia as well, who've been involved in the project. So with no more ado, I'd like to hand over to Keith Newton, our International Secretary General, to say a few words.
Good, thank you, John. It just gives me great pleasure to welcome you all briefly to today's webinar. This is our 15th international webinar, as John has said. We started them in April last year. That seems a long time ago now. But let me also, alongside John, welcome all our delegates from around the world today, listening either on Zoom or Facebook. And of course, welcome those who are maybe listening to this after the event on our recordings on YouTube. And may I particularly give a warm welcome to our HVT friends who are joining with us today. HVT stands for High Volume Transport, as you can see on this slide. And the projects you're going to be hearing about more on this webinar were funded by UK Aid through the UK Foreign, Commonwealth and Development Office under the High Volume Transport Applied Research Programme managed by IMC worldwide. So more on that later. We began on this journey as CRT nearly 12 months ago as we designed our global approach to the COVID pandemic. One of our key strategic responses we decided at that point should be collaboration. And when some of our younger members spoke to us of difficulties in Tanzania, we approached TransAid, who linked us to HVT at that point in time. The story started there back last summer, and today you will hear about how it has progressed since then. Now, a year later, we've learned some of the benefits of working collaboratively, and we still do. We have learned some of the benefits of sharing best practice across the world. And I'm sure that today's session will continue as we talk about the impact of COVID in lower income countries. And that's continue that collaborative journey. We will share with you today our Tanzanian experience in understanding, linking that to policy and practice, and seeking to lead the response to the issues that we face in our transport and logistics sector. The Tanzanian projects particularly have helped us to, have enabled us to practically work with and use the skills of our younger professionals, the next generation of the CILT world. I personally have known a couple of the speakers today, Cyprian and Masoud, since I first met them in Tanzania in 2015. And the projects with their leadership have enabled other CRT professionals, both younger and older, to bring their skills and expertise into play. So that's enough for me from me as an introduction. Please do enjoy the session. And I'm going to hand over now to Hvt Background from the HVT program team to also welcome you. Hvt.
Thank you very much, Keith. Good morning, good afternoon, and good evening, everybody. John, could you please give me the next slide, please? So I'm going to tell you a little bit about the Hvt background, how it was formed. So it started off with the fact that the transport sector in low-income countries, we're aware that it is a very large recipient of aid and public funds for investment just because it's fundamental to the economic growth. However, we're also aware that research activity is minimal and the evidence base for huge investment decisions are out of date. And that is the reason the transport sector is something that does need further investment. So it's changing fast, and it's also facing a lot of challenges, especially in the low-income countries. So we've got challenges like the climate change that is facing everybody, including the low-income countries. And obviously the current one is the COVID-19 challenge that's facing everybody. So in late 2017, IMC Worldwide established a program management unit. So this is to manage the high volume transport program. It's a 5-year FCDO, so the Foreign Commonwealth Development Office funded applied research program, and it seeks to update all the technical best practice for transport infrastructure in low-income countries. Our goal is really to get new knowledge that helps policymakers in low-income countries. Our goal, and then it is really to improve the transport for all citizens. It is to reduce environmental impacts, to harness technology while learning from mistakes of middle and high income countries, and where possible to leapfrog technology. So beneficiaries of the program are the transport decision makers and development policy makers, central and local government, transport practitioners, private sectors, civil society, and other relevant stakeholders across Africa and South Asia. So the total budget for the research and activities around research uptake, capacity building, knowledge management, over the 5 years is 14 million UK pounds. We have so far launched many competitions for funding. I've been involved in 2. One is something called the T-Tread, and now I'm involved in this one, which is the COVID-19 Response and Recovery Transport Research Fund, where we funded 21 projects, of which we are pleased today to see 3 of them being presented and discussed today. Next slide, please. So the ultimate aim of the high volume transport program is that the knowledge that emerges from the research is used by policymakers and transport practitioners in Asia and South Asia and Africa to inform their policies and make transport accessible, affordable, safer, green, and inclusive. The HVT priority research areas are very much around policy, regulations, including engineering, technology, and innovation. So this is very much a sort of decision support systems and data research uptake and looking to building capacity. Now, I've also added into this slide a link where you can subscribe to the HVT newsletter, and I recommend that you do that because you will not only learn of all the research that is being published there, all the work that's being done, but also it will give you the information for any new coming funding that's available, and we welcome more applications from you. I would also like to take this opportunity to thank very much CILT, and in particular John Harris, for all the support he has really given to the 3 projects and HVT as well. So thank you very much, and I'm passing on to John Harris.
Thank you very much indeed, Hvt, and again, Weird Echo. It's been great to be able to partner, and what Keith said in his introduction, we do hope that this is an opportunity for us to develop strategic links with aid organisations, but also those carrying out important research. So before we get into the the final detail of these three projects, I'm just going to explain a little bit about why CILT internationally have become involved. Now, the reason for this is that we have three projects working together. So we're going to be hearing from Julie shortly about the Disability and Mobility Programme. We're going to be hearing via video link about the economic impact study, and that was led by Zedriga and Mohammed. And then also we're going to be looking at safety and well-being on public transport with Cyprian. Now, the important thing is those issues are not to be dealt with in isolation. Those issues, when we actually started to look at the impacts on end consumers, on transport authorities, on local municipalities, on the health sector, they are inseparable. So one of the things that we decided to do very early on is, rather than have three parallel projects getting in touch with similar stakeholders, was to start to glue together this. So there ended up being a single survey venture, which made it much easier to engage with the authorities. But also, Keith kindly reached out to the other Eastern African countries, and they kindly agreed to also deal with some of our questionnaires across our members. So this resulted in a overall feedback of over 2,530 responses from organizations and individuals. So hopefully, by being the glue that bring together some of these common issues, we can now start to be outward looking. We know that the main focus is on lessons learnt in East Africa, but we believe that there are some key messages that are coming out from the research that also impact on other lower income countries. And of course, our CILT country organisations do include nations that are either low or medium income level locations. So a few things have also happened since the project started. We've had an opportunity to help other HVT program activities, where we've been able to reach out and bring together thinking from Sierra Leone, Uganda, and a couple of other of our African communities to help on policy development. We've also been working with HVT on development of policy tools. So this is a very simple guide to convert technical reports into headline issues, evidence, or direct policy recommendation papers to influence government and other stakeholders. And the beauty of that is we've been able to use that to support our own team, but we've also been able to use that exact same approach to help the other HVT projects. And we will also be using the guidance to help CILT countries with their own policy voice. So more on that, and if you are interested in that, please do contact me after the webinar. Now, as we said, this is the beginning of a journey, and one of the things we would like to do is engage with those of you that have registered for the webinar. Now, if any of you are viewing through Facebook and want to get involved with the LIC debate and actually have some input into what you are hearing, we would welcome you to get in touch. And that's through getting in touch with me at john.harris@ciltinternational.org. For those of you that have registered and we have your email addresses, as follow-up, we would like to ask if you would be kind enough to engage in a really short survey around the LIC debate in your country and how what you're hearing today resonates with you. If anyone doesn't want to be contacted, please just drop a note in the chat and Jasper will make a note of your name. But we do hope that those of you that have taken the time to join perhaps would like to give us a little bit more feedback after the event. And I know that HVT will really appreciate that. So that's enough from me. I'm going to now hand over to Julie, who's actually going to lead you through her own presentation. This is the largest of the three projects, the Disability and Mobility Project, but nonetheless, the other two are of equal importance as they look at other important economic and social factors in Tanzania. Over to you, Julie.
Yep, cool. Okay, so I'm Julie King from Hvt in Australia, and are you just going to change the settings on this? Okay, so this part of the webinar, I'll talk about the disability research that we did in Tanzania. And as John mentioned before, we had quite a large sample. We did two parts to this research. We did a survey with closed questions and some semi-structured or open-ended questions in order to be able to get a picture of the stories of the people who have disability, which is so important. So first off, I'll just start off with some background, as some of you may not be that familiar with disability. And I think what people often find really surprising is that over 15% of the global population have a disability. This was through research that was conducted by the WHO and the World Bank in 2011, and has not really been updated. As you can imagine, is very difficult to actually get an overall guesstimate of the proportion of people who have a disability, but that equates to around about 1 billion people. So that is an incredibly large amount of people that have a disability. Approximately 9.3% of Tanzania's population lives with disability. We would think that this would be an underestimate, given that the global estimate is 15%. In Australia, just as comparison, we have a disability rate of around 18%. So for a country that doesn't suffer from huge amounts of road traffic accidents, is a rich country and has good medical care, it's reasonable to make the assumption that 9.3 is actually a low estimation of the population in Tanzania who have a disability. So when we think about disability, and the terms to describe disability is very fluid concept. Disability in one country might not be disability in another country due to technological advances or the sorts of physical aids that people can actually get. But we describe it as a dynamic interaction between impairment activity, limitations, with participation, restrictions, and interactions with the world around us. So that's why we say it can differ from country to country or from region to region because of the access to technologies and medical care. The environment, personal, socioeconomic context factor in the functioning and the experiences of people with disability. So that's why it is important to often contextualize where we're talking about when we talk about disability, because then we know what some of the issues may be. It's also important to remember that disability is not a homogeneous concept, that we have four broad categories of disability. We have physical disability, which most of you would probably know. We have sensory disability, which includes people who have sight, hearing, or language issues. We have psychosocial disability, which are disabilities caused by mental illness. And then we have cognitive disabilities, which can happen, for example, if you have a road traffic accident, you end up with a brain injury that causes issues for you. But because of the reasons of context, we are looking at mobility and transport access. Okay, so when we look at transport and disability, a lot of the issues are cross-cutting, but they're also across the globe, but are far more entrenched in low and middle income countries. So there is a need for safe, reliable and affordable access to safe transport. And this is critical when we think about health and well-being, when we think about access to education, access to employment. because transport is linked to a range of critical services. And if people can't get to healthcare, which was a problem during COVID-19, as we've seen reported, then it can cause great issues for not only the person with disability, but often their families as well. So a lack of accessible transport can cause significant issues and can lead to people having higher rates of social inclusion, having a poor economic status, being not able to get an education. We could talk for ages just about the personal impact that disability has on people. So pre-COVID, vulnerabilities and exclusionary practices were there for people with disability. What we wanted to find out in this project was, has COVID-19 actually impacted disproportionately on people with disability? So from that, our research question was, what are the impacts of and the responses to COVID-19 in addressing the mobility of people with disability or reduced mobility in Tanzania? And we looked at 4 different regions, Dar es Salaam, Kagera, and the Zanzibar regions. And I probably missed one out there. So first of all, when we started off, as with any research that you do with people with disability, consultation was done with disabled people's organisations, and you can see that there is a list of the various organisations that the Tanzanian team actually engaged with to get their support, but also to get an idea of some of the issues before we actually started to formulate the questions. This is important because as able-bodied people, we do not know what some of the issues are that are faced with people with disabilities because we don't have that experience. So the methodology and the methods that we used a mixed methods methodology. We used qualitative focus groups. They were conducted with 218 people with disabilities in Dar es Salaam, Kagera and Zanzibar. We did a survey with 1,167 participants using closed and open-ended questions with people with disability. And to get this, we did purposive sampling, which means the reason we wanted, or the purpose was to actually get people with disability. That was the purpose of the sample. And convenient sampling, where was an opportune moment to actually get the people with disability, where we could talk to them, where it is not impacting on their lives. So the findings, I'll briefly talk about the demographics. So majority of the participants with disability were either unemployed or in low paying jobs. Many of these were in the informal sector. Just over 50% of the respondents were women, which reflects the population of people with disability. Slightly more people with disability are women. Just over 56% reported having a physical disability or a mobility impairment. And this is not surprising given that when we look at who we see who has disability, who are not as stigmatized as some other groups, that's people with disability, with physical disability. So the rest consisted of psychosocial disability, those people who would have had a mental illness, around 24%, partially sighted and people who were blind at 28%, and partial hearing impairment and deaf at 20%, and learning impairments less than 1%. So clearly a reflection of what we would expect in a sample due to stigma and discrimination. While all participants reported that their disability was since birth, we do think that the question may have been misunderstood, as majority of the participants said yes, but then when time of having a disability was given, most participants gave a time period, so 14 years, 7 years, for example. And here on the side of the text, you can see the age range So the majority of the people were 26 to 35 and 56 to 65. When we looked at types of transport that people took, they were able to tick whatever they have taken in the past. So bus, the Dala Dala, the Boda Boda, and less so for Uber, which is more expensive, and train and taxi also were fairly well used. Taxis are often used for people with disability because of carting around wheelchairs, which are a problem getting onto buses and onto other transports. However, they would be expensive, and we've seen this in the qualitative research. The response is that, you know, people cannot afford to actually catch a taxi because of the cost. When we looked at the main reasons for travel, employment came out at 47%, but again, they could tick all those that apply. It's interesting that social comes out really, really high in this because, you know, people with disability have high social needs, obviously, because of social exclusion, and family were also visited a lot, and health. So quite a good range of people accessing all those areas. Okay, so when we look at what aid people used, not surprisingly, it was wheelchair, given the proportion of the sample that had a physical disability. Walking sticks, crutches, and white canes were also noted. Interestingly, hearing aids are there, which from research I've done, I found that really surprising, given the cost of that sort of disability aid. We looked at travel frequency, and again, this was something that was really interesting. When we look at the times that people travelled, or the amount that people travelled, women were travelling more than men using public transport. I don't know that we really have a reason for this, but it's just interesting to note that there's a gender disparity in that one. Interestingly, when we asked them how often people had travelled during COVID, the number actually went up in monthly for both men and women quite significantly. Again, we don't have a reason for that. It would be interesting to follow up why, or whether some other people on the panel have an idea about that, but I can't explain that one at this stage. Okay, so looking at some of the qualitative answers that we got from the survey. So one of the first questions we asked was around the travel patterns and, you know, examination of the impact of COVID-19 on travel patterns for people with disability. So pre-COVID, majority of the participants said that they were treated normal. We had to actually check that because that was a really surprising answer. And, you know, translating from Swahili into English, some got lost in translation. So Cyprian did a follow-up with a small sample of participants. And what they meant by that was actually little care. So people with disability were given little care on transport, and that really is what we would expect to find. When asked about travel during COVID-19, 82% said that they found travel more difficult, and this was for various reasons. So participants gave different reasons, but one of them was an increase in transport fee, an increase in the cost of transport and travelling, little cost increase for some routes. So there was a pattern of this that flowed through the survey. Today I've done some analysis of the focus groups, and this came out strongly in the focus groups. What also came out in the focus groups more strongly was even a slight increase is a problem for people with disability, as many people with disability live in poverty. And so some of the informal sectors in which people with disability were working changed during this period. For example, a woman who was begging on the street, obviously if there is lockdown or there's not as many people travelling, there's not as much access to people who might donate. Also, people lost their jobs, and so it became more expensive. So there are a lot of sound reasons for why this actually happened. But this extra cost, when we think about what that actually means for people with disability, you know, every cent counts for a person who has disability, who lives in poverty or has a very low income. So the lack of access to healthcare, the lack of access to employment, education, and that can result in higher rates of social exclusion for a group who are already excluded. So hospitals were far to reach. Many times only traditional herbs were accessible and depended upon them. This also came out in the focus groups as well. A lack of transport and changes to routes also attributed to causing other issues. So people talked about the access being difficult. It was hard to get a dala. There was a shortage of transport or no transport for some routes. So there were transport changes, not just that there was less transport on the roads, there was a change in routes as well, and a cancellation of some routes. So leaving some people stranded and not being able to access services or employment or see family, for example. So participants reported a lack of access of seats. And as you can imagine, for a person who has a physical disability, this can make it both risky and uncomfortable. People also talked when they said this, as in response 21, people were strongly fighting for transport. So you can just imagine on a crowded dala or you know, on this minibus here, which is crowded, which was a picture before COVID-19, having nowhere to sit and being jostled can make a person with disability feel quite vulnerable and could add to the possibility of injury if they fall down, if they're knocked down. If the person is sight impaired, just not being able to get a seat and feeling the motion of the bus and people pushing can also be frightening for a person who is sight impaired. So this was very, very important. It came out for a large proportion of the participants that not having a level seat, which again, we had to check how that was translated, meant there just wasn't enough seats for people with disability and that they had to fight for them on the bus.
Thanks, Julie. Just a 5-minute warning for you. That's all. Thank you.
Gosh, that long already. Okay. So participants were asked, you know, what their risk was related to, whether it was disability, gender, age, or less transport. So the majority said that it was disability that worried them the most, that their disability they felt made them more at risk. And you can see some of the responses below. I'll let you read those. And 15% reported less transport related to COVID-19 as well. In order to be able to put some of this in context, we also wanted to get an idea of community views on disability. And although a small proportion said that they were treated differently, we think that again was lost in translation. But the responses that I have down here clearly align with the evidence in the literature that they feel rejected, segregated, have few friends, treated like a burden. And this has also come out very strongly in the focus groups. So what did we find? So travel was difficult for people with disability before COVID-19, and this is evidenced in the literature. And I think I have the wrong slide for this, John.
Oh, apologies. There are two conclusion slides, so we have.
Oh, okay, that's why. Okay.
Yeah.
So this is what we found. So COVID-19 increased the vulnerabilities for people with disability due to extra cost and the difficulties in getting seats. And this was most likely due to socio-cultural beliefs around disability with high rates of stigma and discrimination. Of the older people who answered, they did not find a significant difference in the COVID-19 period. Evidence of issues related to gender did not come out significantly in the survey, but was talked about more in the focus group. And the impact of access to transport during this period would lead obviously to less healthcare access and education. So what next? And I think this is actually a really important slide. Disability and gender are both cross-cutting issues, and any ideas or any recommendations that we come up with need to be realistic because of the broadness and the depth of the issue. The research has highlighted problems for people with disability in accessing transport, and the pandemic has exacerbated this, as we would have expected. But the key learnings from this research should be used to inform and educate the transport sector. Lots of people in the transport sector do not understand the needs of people with disability. So this could take form in training or induction programs for new people coming onto staff. Findings could also be used to inform infrastructure design, both in the built environment, such as ramps, lighting and seating, and the vehicles actually purchased and used in the transport sector. And I think this is really useful information, particularly if there are new areas of infrastructure where if it's put in place in the first place, it is much cheaper than retrofitting after. And so simple things like lighting at bus stops can make safety a lot better for women, for example. The economic impact of COVID-19 created financial hardship for many people with disability. And in some countries, and this is something that should be explored, in some countries, public transport for people with disability is actually free. I realise that because there is part of the transport sector that is privatised, this could be subsidised by the government, or there would be other ways of doing that, keeping a couple of seats for people with disability that can be used by other customers, but if a person with disability enters, those people know that they actually have to get up and let those people sit. I think finally, which is important from this experience, we know that the issues that are faced by people with disability in low and middle income countries are very, very similar in transport across the globe. And what we have learnt from this is transferable to some degree, or to a large degree, to other low and middle income countries. So I think we can use this research to inform policies in other countries, but also some of the other key learnings as well. So that's me finishing off.
Thank you so much, Julie, for a really comprehensive summary of what you've achieved there. Really, really helpful. While the new slides get prepared, so we're going to watch two videos, one after another now. While that gets teed up, Julie, in 30 seconds, what was the wow factor for you? What was there an outstanding finding which really hit you between the eyes about what you discovered on this journey? with all of these people that were sharing some quite personal stories. What stood out for you?
I think, you know, having worked in the area of disability, I think it really was just something like a pandemic, an extra burden for people with disability can make their world collapse. There are no safeguards. People with disability during COVID-19 were exponentially impacted more than the rest of the population. And I think that clearly came out through that, that, you know, when we talk about, you know, rehabilitation, you know, trying to do something after this, I think the voices of people with disability need to be included in that. It needs to be inclusive.
I think the challenge there for us all, I think all of us in the transport and logistics sector would see ourselves as agents of change. Hopefully we all do, whether it's at policy or practical level. And what you're saying there, actually, I think, Julie, passes beyond even low income countries. It actually transcends. One of the key things we've learned here in the UK, you know, as what we would call obviously a relatively developed and mature economy, is something as simple as disabled people that need to use the train to access hospital and all of the support things that needed to happen to make them feel safe. Again, that was an exponential issue. So it does cut across cultures and economies, and so hopefully there's a takeaway there for all of us, actually, in what you've shared. Thanks, Julie. We'll come back to you in a bit with the panel, but we're now going to hear from two further speakers. This has been pre-recorded for the simple reason that we wanted to make sure that the sound and the quality was going to be good for everyone, but the speakers will actually be available for the panel at the end.
My name is Cyprian Moses, and I am the project coordinator, which the project was aiming to look at the impact on transport workforce during COVID-19. And also we did this project, was funded by the UK Aid under the High Volume Transport Program. And we are here presenting here today with Madam Lukia Shamte. Lukia Shamte will also join me in the panel discussion later, but she was the principal investigator of this project. I hope we'll get to discuss later about more of this project. But here I will take you briefly about the project. We conducted this project since November 2020, and we aimed at looking through the different phases. So we looked at the period before COVID-19 in Tanzania, especially to transport workforces. And also we looked at the period during business as usual as regarded to when the government stopped putting on the lockdown measures such as restricting travels and all that. So the period before COVID-19 in Tanzania was the period before March 2020. And also the period after COVID-19, the period during COVID-19 was from March to May 2020. So also the period when there was business as usual was the period between from now June until now, of which we evaluated from June to December. So during these different three phases, we looked at what is the rate of the exposures or rate of the exposure of these transport workforces are given to COVID-19, and if there are any measures that can be taken to protect these transport workforces. So we looked specifically on analyzing the use of personal preventive equipment, PPE, and this is the simple graph that summarizes the findings. And also we looked at, this is the simple graph that looks at these different periods that I've spoken before. And you can see here from the graph that before March, this is before COVID-19, you can see that the graph was rising. The actual exposure rate was starting rising. Like it was a period when we identified like the transport workforces were usually not really exposed to COVID-19, and they were using PPE at a lightly way, we can say at a fraction of optimal rate, but we usually didn't really estimate the rate of the use of PPE. So our graph, you can see like it started rising. So the PPE were not really used at a massive rate or at a big rate compared to the period between March to May. So you can see that when the March period was just getting started, the graph rose rapidly. So you can see like now many transport workforces started now using PPE at workplace. So we identified the use of personal preventive equipment at workplace alone. So also this period was also subjected to government promotion on the use of PPE. The government started promoting the use of PPE from March to May. We didn't see this trend before May. That's why we can see another graph has been started from March, showing that the government started promoting the use of PPE. But you can see this graph is coming up to a place when it's now interlinking between the government promoting of PPE and the business as usual. This was the period when the government from May, now the government started promoting the use of traditional herbs, as promoting like there is no more COVID cases. So people should just use traditional herbs to protect themselves. So many transport workforces adopted that, and the government stopped promoting on that. But still, a lot of transport workforces were more exposed. And we found out that more transport workforces who were working at the public sector were more exposed compared to the transport workforces who are working at the private sector. And this is due to the fact that many private parastatals, many private agencies were promoting their workforces to keep using personal preventive equipment, as they were interacting a lot with the international business stakeholders. But the public government stakeholders were depending a lot on government official statistics. So many of them really didn't use personal preventive equipments. So these were the trend between before March to May, and from March to May, and from June until now. And this is now, I've spoken a little bit about this in my previous slide. You can see that from the period of March to May, a lot of transport workforces in the private sector were using PPE, and that's the same to the public sector. We're also using PPE, but the trend was changing from March to May. The trend changed. The trend changed for the transport workforces working in the private sector. We can see that from March to May, they had a wider access to PPE. Now, this is accessibility and economies of scale, because we identified these at different rate of scales. So on the accessibility and economies of scale, the rate was changing. There was a wider access of PPE for the transport workforces working in the private sector, but it was different to the public sector. There were limited access to PPE at workplace. And we found out that in the private sectors, they had all of the equipments installed. For example, they had sanitizers, they had hand washing equipments. Subjected to the public sectors, they only had many of the offices or many of the workplaces had only hand washing equipments, but sanitizers and all other PPE were adopted at a personal initiative. It was not a parastatal or an agency being inserted these kind of equipments. So also they effectively used personal preventive equipments, whereby in the public sector, they used traditional methods such as herbs during the business as usual period. So this was the change of the trend that we identified at the different scales. So we identified that the capacity and efficiency, as I said, they both used PPE. The majority of transport workforces use PPE, and also the change, as I've identified in the indirect scale, in the accessibility and economies of scale. So now, these are the findings that we would like to advise different stakeholders to take on, and the government should also take on private sector, the public sector, and also all stakeholders involved in the development programs for the transport workforces should also adopt this. And our first is based on how we should strengthen the public health measures at workplaces. So we advise that there should be a program or a measure or a policy that should be adopted to strengthen public health measures at workplaces. This should not just be for the government or for the public. This should be adopted in the private sector, and also should be adopted in the informal transport sector and the formal transport sector. And we have identified transport operators here, but would like to recommend these should be adopted in all areas. You can see here that we have analyzed all transport stakeholders should adopt this at the core of the public and the private sector. And also, we'd like to advise that there should be collaboration and partnership. We have seen this to be a big challenge during our focus group discussions. A lot of transport operators were giving recommendations that there should be a collaboration between them and government agencies such as traffic police forces, or such as the Ministry of Transport should involve them in decision making regarding policy making. So a lot of transporters, a lot of transport operators needed this involvement for them to be involved during the policy formulations or major decision making, because when COVID-19 was being announced for March, a lot of them were just hearing a lot of decisions being made, like there is lockdown, but they are not really involved on how they can continue their business during this period. So they needed consultation on their level. And also collaboration and partnership should not just go on a level of organizational level, such as transport operators and governments, should go down to individual levels, whereby the transport, there should be an equal distribution of collaboration. Like, we should not only collaborate with the male workforces, but collaboration should be for the both gender based, but also should be for the both managerial position based. Like, we shouldn't just bring collaboration to the managerial levels, but all of the chain should be involved, such as the lower transport operators working, such as drivers, should be involved. Collaboration should not end on the managerial level of the organization. And also, this connects to our third recommendation of preventing exclusion and discrimination. We should prevent this on base of gender, on base of income, and on base of the nature of work. We have seen that a lot of women during our focus group discussion were complaining that they are not really involved, even in the promotion at the job promotions. They are not really involved, given this promotion were given only to men. And also, a lot of women were in the front work staff. They are not involved in the managerial or decision-making organizational level. So they wanted them to be involved, and we should not discriminate them in terms of gender. So any policy formulation or strategies adopted by either transport operators or the government should involve that we do prevent exclusion and discrimination at all levels, all operations and the managerial levels, at hiring and promotion, and at both the public and private sector. So you can see that all of our recommendations do intertwine to each other. If we strengthen the public health measures, that will ensure collaboration and partnership. Then we'll find that exclusion and discrimination. So those are our key recommendations, and we really appreciate. And if any question you have, I would like to welcome you.
Okay, thank you very much indeed, Cyprian, for taking us on a whistle-stop tour of the important subject of workforce safety and public safety on public transport. We're going to hear from you and Madam Rukia in the question and answer panel, but just a really quick question for you now. Personally, what was the big message that came out of the transport workforce research for you?
I think personally, a big message was that I got to experience how people feel really during COVID-19. I've got to experience their pain points and their struggles, especially the informal sector. We got to hear from women who was a bus conductor. She literally was a bus conductor in a public bus, and she was speaking with a very emotional tone, like she was really exposed to COVID-19 and she was afraid to tell, even when she was sick, she was afraid to tell her boss that she was sick because there were no sick leave being paid, and also there were no PPE being supplied to the public bus operators, only hand washing equipments, but nothing else was supplied. No face mask, no anything. Yeah. So I got to experience this kind of pain points, and it really touched me. And this is what we really, if what we have recommended will be taken on board, I think we'll go further to ensure that everyone is taken on board in preventing COVID-19.
No, thank you very much, Cyprian. I mean, we can't underestimate this personal impact thing. And I guess all of us on the webinar today will have personal stories of how their family, their friends have been impacted. So it kind of makes it real. I think the final question for me is, looking at the policy interventions here on this slide, is if there was one key measure that you could ask to happen overnight around COVID-19, what would it be?
Yes, I think if the key measure should be taken, I think there should be I think the government should now call on for all stakeholders a meeting. We can do this virtually, trying to discuss these matters with the government and with all stakeholders involved. I've seen a break chain of collaboration between the decisions being made and the people who are directly affected by those decisions. So I think the transport operators, transport stakeholders should be involved in this decision, especially at this very moment, as we do depend on transport, but yet we need to involve all transport stakeholders to ensure that we protect them during this period. So I think if the decision should be made today, the government should call for a meeting of a stakeholders engagement meeting and discuss these issues and see how far we can get from here. Yeah.
Excellent. Thank you, Cyprian. And we'll hear from you later on the panel session.
Thank you so much, John. I really appreciate for this opportunity to share about our findings of the research. I really appreciate for that. Yeah.
My name is Mohammed Masoud, a chairperson of Young Professionals in Logistics and Transport, Tanzania. As well, I'm a project coordinator under High Volume Transport, UK. The title of project, the title of our project is to look for the impact of COVID-19 in Tanzania transport sector and the economy. Under this project, we have 4 researchers, which is myself, and I have Mr. Rexon Rodriguez. We have Dr. John Laya, and we have Mr. Joseph Oglit. Yeah, in proceeding with the presentation of this session, I'm eagerly to welcome Mr. Roxanne Zedriga to proceed with the presentation.
I want to thank our project coordinator, Mohammed Masoud, who has just introduced himself and us. And our research topic was designed to look at the economic impacts of COVID-19 across the transport sector, and targeted changes in transport capacity utilization, which was one of the first objectives in maritime, air, road, and railway sectors. It also analyzed the changes in logistics performance as objective number 2, before and during after COVID-19 pandemic. We broke the periods up to end of March, there was no COVID. Between March and May was when there was COVID. And then thereafter, it was declared by the president of Tanzania as being non-existent. So we then analyzed those changes and looked at the economic indicators and see what impact it had on the general economy. This provided us leads with what this means to Tanzania and surrounding East African countries. The study was carried out over 2 months in 4 Tanzanian cities. City number 1 was Dar es Salaam, which is the commercial hub of Tanzania with intense transport connectivity. City number 2 was Arusha, where the East African Community Headquarters is based, and consequently, it is also strong transport connectivity. City number 3 was Mbeya, hub to neighboring countries in the south, like Malawi, Zambia, Zimbabwe, DRC, and South Africa. The 4th city was Kigoma, the port hub, which links to DRC, Rwanda, and Burundi. All this was done because in the extensive doing the research, we did a lot in terms of what we call smart survey, which was circulated to over 333 respondents, and they effectively responded from these countries, and therefore it was important to have that done. What we found could be summarized as follows. Number 1, there was significant decline in transport capacity utilization during COVID-19 pandemic. Equally significant as number 2 was the decline in logistics performance during the same period, as mentioned above. There was also decline in general trade and commerce during COVID-19 period and had impact on economic stagnation, mainly because people were not allowed to travel freely, and to some extent, some people decided majorly to stay at home. So there was a general decline in that direction. There was also a reduction in transport capacity and operations, which did affect logistics performance across the board. What could then be the next steps, which we thought would be very important in terms of a summary today? The final report provided guidance on the overall impact of COVID-19 across Tanzanian transport sector and the wider economy based on the critical findings. Secondly, it also informed policy issues and choices to be made in future briefs to guide policy development and implementation, especially in the transport sector. The third key lead was secured for knowledge sharing with the neighboring countries such as Rwanda, Burundi, Zambia, Uganda, DRC, Kenya, and Southern Sudan. Basically because COVID affects these countries to a very great extent. But Tanzania, as more or less said, they are not heavily infected in that area. Finally, it gained wider application for low-income countries facing similar challenges of COVID-19. What does the future look like for lower-income countries, especially when exposed with this kind of information? The findings show that there is a need to take important approaches, especially in policy measures, to cover the remedies. First of all, the remedy of face masks. Secondly, the issue of washing hands at every business place where you are. Third is physical distancing, so that people keep not too near each other and therefore infect one another. Then fourthly, we have also elements of isolation of those who are actually infected. And so for this to continue, certainly it will have a big impact on the economy. And yet, it is also important that the economy subscribes to the treatment of this COVID-19. In that respect, we are recommending strongly that government should be able to venture in terms of giving funds for purposes of this. Secondly, one of the critical things in future we look at is we would like the approach Uganda AIDS Commission had in terms of its approach to handle HIV and AIDS. They developed a policy document called Multi-Sectoral AIDS Control Approach. And that worked because all the sectors, all key sectors, ministries and what have you formed the branches so that there was a lot of wide publicity. And certainly people became aware of HIV and AIDS, and therefore they began to take precautions in order to protect themselves. In a similar manner, we think for COVID to be effectively tackled, there must be that kind of formation of multi-sectoral approach so that all sectors, including transport sector, get involved. Ministry of Health gets involved. NGOs concerned gets involved, and so on, so that there is a unitary approach towards handling COVID. How can we transfer lessons learned? We're prepared to share our findings with various countries, especially through Cilt International, so as to share what we have found out and the key issues of policy recommendations we have made so that it is used elsewhere. What policies and practice need to change, especially the policy where transporters were allowed to crowd passengers in vehicles. Pathways were all, and even now, it is actually resumed in that instance. We would like government to make an effective policy so that people transported in minibuses and all buses are in sitting positions so that the issue of physical distancing is observed. I think that is very crucial for us. And certainly, we now know also there are some vaccination drugs which have been got. Government should also venture into getting those vaccination drugs so as to handle the COVID cases. These are the critical things we think policies should be done so as to handle COVID effectively in Tanzania. Having said that, I think that is the summary of what I could be able to say with respect to the impact of COVID-19 on Tanzanian transport sector and the economy. We think that even economic policy interventions must be able to target the issue of COVID-19 if we have got to succeed. Thank you very much for listening to me. If there are questions, I would be prepared to listen and hear. And if there are things which did not come out clearly, I would be prepared to answer appropriately. Thank you.
Okay, well, thank you very much indeed. We've had a real feast of learning today, haven't we? Looking at three very important areas of COVID-19 impact, but a common thread you're seeing between them. We've got just about 15 minutes for our wrap up. We'll be finishing just after 10:30 our time. But I now want to bring everyone together to just ask a few questions. So if everyone wants to go back on screen, Cyprian and Madam Rukia, we'll welcome you back into the room. And we've got a few questions have come through on the chat. So my first one is around policy change. I think all of you, without question, have mentioned the importance of policy and government. Bruno has messaged in, Bruno Kinyaga, observing issues around job losses and this whole issue about workforce and the impact of COVID on people losing their jobs and well-being. So let's just start with that. Is it a simple thing just for government to wave a wand, or do you think we've got to be a bit more creative around the policy messages? So I don't know who'd like to, Julie, would you like to kick off with that, and then we'll bring in others?
Yeah, I think, you know, policy is really important, but sometimes policy is a paper tiger, and there really needs to be a clear strategy to implement any new policy that is put in around this. And I think it needs to be sold in a particular way. I mean, over the years, I've found that if you can sell the advantages of a policy change to governments, they are more likely to take it on. You know, what are the benefits for the government? You know, they're there to also have, you know, then basically they're not going to take on anything that looks too big, is not targeted, or where they can't see the benefits both for the government and the people, whether that's resources or whether that's politicians being politicians.
Okay, thank you, Julie. Cyprian and Madam Rukia, what's your view on this?
Personally, and also I can see the question also relates to what Kim van der Wijk in the chat tab just asked recently, and I would like to recommend that, you know, the policy and how the government can interact and can respond to that is usually depending on how we as stakeholders, how do we lobby, or how do we make sure that the government is involved or is asked to respond on a certain matters. And I can relate to the current situation right now, and now I'm going back to the question of Kim, that now you can see that the government has started recognizing that there is COVID-19. This is usually between the period of February 2021, and they have now recognizing that, okay, there is now COVID after some few stakeholders been speaking about it. Yes, so I can say that if stakeholders speak out and try to advise the government will take measures and will take those recommendations. So we do believe that these are the issues that we as stakeholders should take on lead to ensure that the government make decisions on policy matters. So it's us to stand out and to try to push the matter forward.
Okay, thank you. I mean, Kim has made a comment in the chat here around ongoing monitoring. So I'm going to challenge Hvt now, because obviously the work that HVT have been doing is a shot in the arm. It's funded and very, you know, generously funded. However, where does it go next? So a lot of good stuff has happened here, but where's the monitoring, and where do you expect as HVT the responsibility to lie for ongoing measurement? This is a question that's been raised.
Thank you for the question. So the way I see it is at the moment we've got 4 projects that are published, 4 reports out of the 21. We are now looking obviously for further reports to be published by end of this month, probably more than another 6 or so. But we're looking for the projects themselves to do a lot more dissemination so that other countries can learn from the research and benefit from the learnings from there, so they can then put in measures in place to then deal with COVID-19 a lot more effectively. Obviously, everybody's aware of the big vaccine program that's going ahead side by side. So hopefully we will be able to tackle, you know, the COVID-19 and, you know, the challenges that we're facing now. Hopefully will start becoming more under control, and we should start, you know, having a more normal circumstances again. But there are huge learnings from this pandemic, and I'm hoping that in future the learnings from this are kept and maintained in case of future pandemic outbreaks as well.
Okay. Keith, can I come to you then, because that seamlessly comes into us as CILT. We're a global organisation. We've been reacting to the COVID crisis, you know, almost immediately when it started. What's your vision around CILT's role in some of this dissemination?
Thanks, John. Yeah, I thought you might bring me in there. Well, I think we have to recognise where we're at, which is we've made some great progress, I think, particularly engaging with a lot of people through these projects. And that's, as I said earlier, the advantage of collaboration here. As an institute, we have a devolved model. So we engage and involve people on the ground, the experts on the ground, the people who understand the country, understand the politics and the situation there. And I'm really hopeful that the base that we built here, just through these projects, we can continue through CRT Tanzania, through engagement with the professionals who are working in the country and in the wider countries. So I think we've just started here. Clearly, and some of your other questions get at it. There's some political issues there, but our opportunity as CILT, I think, is to work with Cyprian, Moh'd, all those that you see on the call, to take these issues further forward, to engage with the government there, and to find ways we can practically help. So I think there's another stage still to come, John, but we've made a great start here in actually building a base of committed professionals who can work together with us. We can support internationally, and we can tackle some of the core issues, I hope.
Thank you, Keith. And Hvt, when all of the projects are uploaded, we would be more than happy to share all of the HVT project findings, because many of them overlap with other African and Asian countries where we operate. So even if people have checked in today just to see what's happened in Tanzania, there's probably something that's happened locally in their own country. And that will also inform the CILT branch committees and others in decision-making capacity. So that will be great. I've just got one more question. I know that Zedriga and Roxanne, this is one for you. This is around cross-border issues. So Paul Starkey's raised a really good point about, well, all the other surrounding countries still have a declared pandemic, but Tanzania doesn't. So how do we deal with that? And the fact that obviously for economic survival, cross-border trade is needed. So is there a view you've got on that from the economic perspective at all? I'm just checking. We may have just temporarily lost them. Would anyone else like to take a view on that, around what happens if one country says no pandemic and the others say we have an issue?
I can take that one, John.
Thank you, Kia. Yeah.
Yeah, I think during the last March May period, it was really tough, and there were a lot was going on. Discussing this issue of inter-country transport, that cross-border transport. There were issues like other people wanted even to do transshipments at border points, and people really tried to work so hard to try to explain the situation, how it will be costly, and it was agreed that, okay, we should have these people all tested, the drivers. Although we still have a few issues that there is some delay, but at least there is the cross-border trade going on, and that buses are allowed to cross the borders. So I think that's all. That's what has happened so far. So I think we continue to talk, as Kate has said. I mean, use the transport organizations to try to lobby on policy changes and policy additions to improve the transport situation around this region. Thank you.
Yeah. Thank you, Madam Rukia, and I think we'd echo that. One of the beauties of CILT is we are an independent professional body. So I know we use the word lobby when we want to campaign for something, you know, that we are passionate about, but the beauty of CILT is it conveys it in quite a balanced way. So it means that we are asking for things that make absolute economic or social reform sense, rather than jumping onto the latest issue. And I think that's one of the moderating factors that I think CILT as an organisation can bring at a local level. What I'm going to do, we've covered all the questions on the Q&A. So what I need to do now is just to be able to go back to my slides, okay? If you could just bear with me one moment. And I'm going to share some closing thoughts for you. A very big thank you to everybody that has taken part today. I think these are the headline things that we need to do. The HVT programme has highlighted the importance of listening. You know, even with the disability project, with over 2,500 people getting involved ultimately, that there's nothing more powerful than listening and listening and listening again. So whilst this has been a snapshot view, certainly the ability for HVT or similar programs and for CILT branches and territories to keep maintaining that listening agenda is critical. If we're going to aim for true inclusion, and by that I mean people being able to access buses, taxis, dala without feeling that they are being prejudiced against, without feeling that their disability is labelling them, that does require effort. You cannot be passive within that kind of area, and therefore true inclusion does require legislative and regulatory reform. In terms of COVID recovery, as we're beginning to see the opportunities, there's some real chances for us to work proactively with our branches, but also other partners like HVT. And hopefully we're going to be able to amalgamate together the CILT and the HVT evidence bank in this area. And finally, you can stay engaged with these projects. I know that we've had a few of you on the call today that have asked some really good questions. We'll be in touch with you, just asking if you'll carry out a very short survey to see whether or not what we've shared today does make sense to you, whether there's any healthy challenges you'd like to make before our three main project authors close down their reports. So, with no more ado, I'd like to say a very big thank you to all of our panelists and to you wherever you are in the world. We hope that this film will be used more extensively, and therefore through the HVT channels and our own, we will highlight some of the social and economic challenges currently being faced in low-income countries. It's now 10:31, and if no one has any further observations, we'll close the webinar, and please watch out for it on our YouTube channel from next week. Thank you so much, everybody.